Good afternoon, everyone. I am Dr. Satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on cervical spondylosis management. And we all know that cervical spondylosis is a degenerative condition of the neck region and neck joints and the spine. And in cervical spondylosis, and it can affect the necks, and there can be pain in the neck, and also there will be neurological manifestations, and the pain can radiate to upper arms, feet, and back also, and there will be pain in the thigh also. So in the cervical spondylosis, there will be uh, there will be pain while movement of the neck region, and there will be loss of coordination and weakness, muscle weakness, fatigue, and headache, and other manifestations, other complications also. So in case of cervical spondylosis, we have to diagnose it early and manage so that there will be no complications. So in case of cervical spondylosis, we can diagnose it by performing X-ray of the cervical spine region epilateral view, and in that case we can found the bony spots, and also there will be some osteophyte formation, or there can be other bone related findings, and we can also advise for MRI cervical spine, and CT scan cervical spine can also be done. From that we can know the soft tissue changes and also the disc changes. There will be in severe cases there will be compression of the spinal nerves, and for that region there will be pain in that will be radiating to the uh, arms and feet and back also. So we have to first diagnose it like this, then we can manage it by ice therapy, rice regimen, that is rest, ice therapy, compression, elevation, and we have to avoid overhead pillow, and medications, pain medication like non-steroidal anti-inflammatory drugs we can use like ibuprofen, naproxen, and aceclofenac, etc. And we can use corticosteroids also if there is inflammation, and also we can use biologics if there is association of cervical spondylitis, and we can manage it by physiotherapy, exercises also, and there is role of physical medicine rehabilitation specialist, physiotherapist, and orthopedic surgeons, and also DM clinical pharmacologists can play a role in treatment, reconciliation, and in case of severe complications of cervical spondylosis. We have to consult the orthopedic surgeons, and surgery is the last option for cervical spondylosis, and it can prevent from complications, and the quality of life of the patient can be improved. So it can occur in case of aging patients like elderly, and also it can occur in smokers, and the cervical spondylosis can also cause due to trauma or injury to the neck region, or any bacterial or fungal infections, and lots of other causes also for cervical spondylosis. So we have to find out the cause and manage accordingly, and in severe cases the patient needs surgery. So it is very important to manage cervical spondylosis patients. Cervical spondylosis can also be associated with cervical spondylitis. So the management is very complex, and surgery needed if medications not works, and not relieved by physiotherapy or any other methods. So cervical spondylosis is a very important topic for all. You can go through different articles, different guidelines about cervical spondylosis management, and you can also search for difference between cervical spondylitis and cervical spondylosis from different articles and from different sites, good sites, so that you will be able to know more about these cases, these diseases. So please watch, subscribe my channels, and watch my videos completely, so that you can learn lots of things about different diseases and their managements. And that's all for today. Happy Saraswati Puja to everyone. May God bless you all, and thank you very much for watching my videos, sharing and subscribing my videos, and thank you for your kindness and your love for my channels, my videos. That's all for today, and we will discuss more on different topics on different days. And thanks again. Happy Saraswati Puja to all of you again. जय जगन्नाथ।